to take over the session. Welcome to you, sir.
अथ शोभानां चिकित्सकं व्याख्यास्यामः यथोवा च भगवान् धन्वन्तरिः. The next is about the shopha. Now, the shopha and vranashopha, these are the two different issues according to Sushruta. Now, there is a bit of confusion about the word shopha, shotha as such in the as mentioned in Chaga Samhita and Sushruta Samhita. Sushruta Samhita has differentiated that vranashopha and shopha separately, and the shopha is a condition where there could be a swelling or a tendency for the swelling or a reaction of the body which can produce a inflammation as such. षड्विधः अवयवसमुत्थः शोफाभीतः रक्षणतः प्रतिकारतश्च सर्वसरस्तु पञ्चविधः. There are two types of the shofa. One avayava that's localized, and then sarvasara, generalized. Now that generalized shofa is the main target of this chapter, whereas the localized shofa is categorized under vrana shofa as such. Tadyatha vata pitta shleshma sannipata vishanimittah तत्र अपसर्पितस्य अर्धगमनात् अतिमात्रम् अभ्यवहृतो वा पिष्टान्नहरितकशाकलवणानि क्षीणस्य वा अतिमात्रम् अम्लम् उपसेवमानस्य मृत् पक्व लोष्ट कटशर्कर आनूप औदकमांससेवनात् अजीर्णिनो वा ग्राम्यधर्मसेवनात् विरुद्ध आहारसेवनात् वा हस्ति अश्व उष्ट्र रथ पदाति संक्षोभणादयोसितस्य दोषाः धातून् प्रदुष्य श्वयतुम् आपादयन्ति अखिले शरीरे. Now this is a generalized shofa causes, and the causes are mainly they related to the diet and exercise. The diet, either it's a total malnourishment or it's a over exercise like traveling or walking for a long distance like, or excessive consumption of the food, and that too particularly pishtana, that's more of flour containing substances, haritaka, absolutely green substances, and shaka lavana, salt substances, also salty substances. Or if a person otherwise is physically weak and consumes more of sour substances and containing soil containing substances, or the particulate materials of the soil, if they are consumed as such, or anupa audaka mamsa, the non-vegetarian food of anupa audaka variety, and excess of sexual indulgence, or viruddha ahara sevana, or traveling on animals as such, so on. That particular diet and exercise is the causes for the shofa. Now, to understand that concept of the generalized shofa, sarvadehagata shofa, we need to have some idea about what is that systemic inflammatory response syndrome, or SIRS, which is a very popular notion, and now these days it's a trending issue. Now, inflammation and the shofa, vrana shofa, we have discussed that part in the Sutrasthana, and we have discussed about the vrana shofa, and more about the inflammation that we have discussed as the local reaction to a tissue injury. Inflammation is defined as response of the body for the tissue injury, and the target is either to repair remove the debris, whatever that dead tissue, non-viable tissue has to be removed, or it is to repair. Now, in a bit more detail about that issue. Once there is a tissue injury of any sort, either it could be due to a chemical or physical or any sort of the tissue injury, there would be a response of the inflammation, and these are now the responses could be studied under three stages. The first stage is the local cytokine production inside the cellular inflammatory response, which is already we have discussed, like which results in the repair, and the endothelial system would be, the phagocytes will be migrating the area and resulting in classical description of the reddish color, swelling and pain and temperature and loss of function. The characteristic 5 features of the inflammation are produced. That's the first stage. Now, next stage is that, and the whole target of that first stage is to repair the tissue, repair the injury, either recover from the injury or whatever that non-viable tissue, it has to be removed. Now, if this is achieved, then the inflammation may end up in the first stage itself. If this goal is not achieved, and if it persists for a bit longer duration, then there can be a release of small quantities of the local cytokines into the circulation, And this actually again also is targeted at improving the response. So the response becomes more prominent. The same signs of inflammation like the local temperature or pain would be increasing. But at the same time, because the cytokines are released, that mediators of the inflammation are released into the circulation, it can result in a clinical symptoms of these pro-inflammatory signs. And of course, it also helps in release of endogenous antagonists for the inflammation, so that there is a hemostasis and homeostasis, the balance is maintained. But that because of the release of the cytokines in the system, patient may present with a low-grade fever. Low-grade fever may be presented as a clinical symptom. There is evidence of the inflammation getting generalized. That's the second stage, and the target of the second stage also, that low-grade fever also, is to defend the body, enhance that inflammatory reaction, so that the injury is recovered, or person recovers from the injury early. But at the same time, the energy is conserved and all the energy is focused on the healing, and hence the patient may have a systemic symptoms of reduced appetite, so on, whatever that Jara Lakshanas. The fever could be a sign as such. If this also has not achieved that, or if there is some abnormality in the course of the inflammation, that results in the stage 3, which is a more difficult stage and which can result in pathological condition. And stage 3 is if that homeostasis or the balance is not maintained with the up to stage 1 or stage 2, then inflammatory stimulus continues to see present in the circulation, present in the body, that the systemic circulation would be affected by more and more of cytokine release, which results in destruction rather protection. So that goes out of hand. And this is what we call as the cytokine cascade theories. Very popular, this became very popular in the context of the coronavirus infections as a COVID diseases. Cytokine cascade theory was very popular, and it is one of that inflammation which results in the cytokine cascade more frequently, and that results in a harm to the body. And because of the huge amounts of these cytokines released into the system, there could be a multiple system getting involved, and this is what we call a systemic inflammatory response syndrome. And there are some theories like multi-hit theory, inflammatory cascade, or coagulation theories are there. Of course, the name systemic inflammatory response syndrome now is replaced by 2016, the Society of Critical Care Medicine has replaced that word with the sequential organ failure assessment, SOPA. But still, that SIRS name still is persisting, and it's being used as such. And that name, SIRS name came up again, revived again during that episode of Corona as such. The SOPA is mainly used for the assessment of the patient's general condition as such. Now, clinical signs of SIRS is mainly the important clinical signs are fever of more than 38 degrees or 100.4 degree or less than 36 degrees. That's hypothermia or hyperthermia. Could be the signs of the SIRS. Then heart rate of more than 90 beats per minute is also the other sign. Respiratory rate of more than 20 breaths per minute, or arterial carbon dioxide tension of less than 32 millimeters of mercury, and abnormal white blood cell count that's more than 12,000 per milliliter or less than that. This also is important, less than 4,000 also. Or if there is a shift to the right and more than 10% are immature cells, that's also a sign of SIRS. Now, same SIRS which is produced due to a infective pathology is called as sepsis. The sepsis is the other word when the SIRS symptoms are produced, or SIRS signs are produced due to a bacterial organism. That condition is called as sepsis. Now, irrespective of whether it's sepsis or other causes, the systemic effects of the inflammation could be of multi-organ involvement. There could be multiple organs could be involved, and the effect could be on either initially, that's first stage, local inflammation, there will be local activation, the same phenomena which I have discussed, like. Now, the further it could be resulting in the involvement of the different organs of the body, mainly, very significantly, the brain, liver, bone marrow are primarily affected in the initial stages, and later on when it becomes more severe, the myocardial depression can occur, blood vessels, there could be thrombosis form, and metabolic dysfunctions of the liver can occur, becomes quite severe, and the edema would be resulted. A generalized edema can be resulted. So generalized edema can be a consequence of a systemic inflammatory response syndrome, and that's exactly the concept of the Chopin mentioned in this chapter. Generalized edema produced due to the other causes. There could be other causes like hypoproteinemia. That's not the subject of this Chopin, and that's under the Shotha as such. That's a different issue, and that the approach is different as such. So the target of the Chopin in this context is about that systemic inflammatory response induced edema. That has to be very clearly understood. Now, just because contextually we have discussed about the serial organic failure assessment in the SOFA condition, the SOFA severity score, which from the current point of view, is considered as more of a better clinical criteria to assess the severity, and there the criteria is almost similar as that of the clinical signs of inflammatory pathology, but some modifications are there. And that respiratory system, the ratio of arterial oxygen tension to fraction of inspired oxygen is one of the factors, and with that you can have a SOFA severity score, or cardiovascular system, that mean arterial pressure and the presence of vasopressor medications, hepatic system, bilirubin level, coagulation system, platelet concentration, neurological system, Glasgow Coma score, renal system, serum creatinine and urine output. These are the measures. By using these measures, you can have a SOFA severity score, more objective number. And there is a website which also helps you to make out that SOFA calculated can be done over the site now, because the whole issue is calculation is a bit troublesome. You have a website over here, and in that website, if you put these parameters and calculate, you can get the SOFA calculation, SOFA score for the patient, which can predict the prognosis. Anyway, this is not the main target of our topic today, just casually, because we have mentioned about the organic failure issues. This also is one of the important issue. If at all anybody is more interested about this medical issue, you can refer to this clinicalc.com one of the website, which gives you free of cost assessment of the SOFA. Now, coming back to the issue of the inflammatory syndromes and the complications of the systemic inflammation, the inflammatory syndromes or systemic inflammation can result in multiple chemical factors, different varieties of the chemical factors, and those chemical factors are mainly categorized into 4 categories. Different variety of the hormones, which also can help in mediating the inflammation or have a role to play with the inflammation, and the hormones mainly are leptin, adiponectin, visafectin. These are identified one, resistin and adixin. These help in the maintenance of the energy metabolism and immunity. That energy metabolism, in the sense I refer to that issue, like whenever there is an inflammation, the body tries to focus all the energy into the area of inflammation, so that the inflammation becomes very strong, and then the source of injury is corrected easily. That kind of action is controlled by these series of the hormonal mediators of the inflammation. Then the other growth factors, another set of the growth factors, which help in new formation of the blood vessels and help in the immunity. Of course, in this we have I refer to only the 3 of them. There are now many more among the growth factors identified, different varieties of growth factors. These further details are not necessary. Then there are some pro-inflammatory cytokines which increase the inflammation. Which increase the inflammation in the sense the total inflammatory activity becomes more pronounced, and these are TNF, IL-1 and so on. Then anti-inflammatory cytokines, which decrease the inflammation, there will be a braking effect, and these are the hormones. Now, my reference to these chemicals as mediators of the inflammation is to have that clear-cut different directions of that inflammatory control. Some of them which will enhance the activity of inflammation, resulting in the more of fever and swelling, which is signs of the pitta. Some of them will help in new formation of the tissues, like the growth factors and vasculogenesis. which are signs of kapha, or anti-inflammatory, which can reduce the source of inflammation, signs of kapha, and then which maintain energy metabolism and immunity, that's the signs of vata, or that's how we can just have that idea. More of that I will be coming to that part. From the practical clinical point of view, along with these mediators, because most of these mediators of inflammation are very difficult to be assessed and not so commonly used, one of the simplest easy biomarker which can be easily assessed in the routine clinical practice is uric acid as a biomarker for systemic inflammation. Uric acid is a byproduct of tissue metabolism, primarily purine metabolism, and if there is a abnormal reaction, so oxidative reactions, the uric acid level will be enhanced, and most of the conditions, most of the clinical conditions which are produced as a result of chronic inflammation, they can be at least their severity can be assessed by the uric acid as a biomarker, and which I do use in the clinical practice quite frequently. Majority of the patients with the chronic inflammatory signs or degenerative, particularly the degeneration produced degenerative pathology induced as a result of chronic inflammation conditions, uric acid is a better parameter to predict about the course of the illness, and of course the causes also. The causes are the dietary factors. I will come to that part. Now, uric acid as a biomarker for inflammatory response is becoming popular. Lots of research articles are presented now, or lots of research articles are being presented now, and I have just those who are interested in studying more about that, you can refer to some of the very popular publications about the uric acid as a inflammatory biomarker of inflammation in different conditions as such, and their importance clinically, because to go into all the details would be beyond the limit of time limits of our lecture. So I have given you that references. With these you may refer to these references, which can give you more detailed idea about the uric acid as a biomarker. Then another very common is the biomarker of inflammation is a CRP, or C-reactive protein. The C-reactive protein also has become since a long time it's being used as a popular biomarker of the inflammation, particularly where there will be more of fibrosis. The inflammatory response result in fibrotic pathologies like arthritis-like conditions, rheumatoid arthritis-like conditions. CRP can be one of the important criteria as such. Then there are some more the biomarkers. Either the same mediators of inflammation could be assessed as specific or non-specific biomarkers. Specific biomarkers like the list of biomarkers which are used in cardiac pathology. Now this is a cardiology reference, like the biomarkers of cardiology, that IL-6 and so on. The different, of course, we will not go into the details of that. But important is from the practical clinical point of view, you have the different biomarkers by which the inflammatory response can be assessed, and the simplest, oldest is white blood cell count, ESR, C-reactive protein, which are the more commonly used biomarkers of the systemic inflammatory changes, systemic impact of the inflammation as such. Then of course we have plenty of the other biomarkers which can be used at a specific condition with a specific target and identifying the disease conditions. The common causes of systemic inflammatory response are again categorized into two categories: infectious and non-infectious causes. Infectious causes, any sort of infection like pneumonia, wound infection and so on, and non-infectious causes like autoimmune disorders, cirrhosis, dehydration, electrolyte injuries, or heart attack, surgery, transfusion reactions, etc. There are plenty of that causes. Again, this list is not a complete one. A exhaustive list is not possible. So that's about the common causes. Now, what's the symptoms? In addition to that, the fever and signs, the persistent inflammation symptoms which can occur could be chronic fatigue, frequent or recurrent infections, joint and muscle pain, insomnia, gastrointestinal diseases such as acid reflux, constipation, diarrhea, anxiety and depression. Very common clinical symptoms where when you may not find any of the specific objective organic involvement evidences. Gastric your endoscopy could be normal, otherwise it may be normal, but patients having anxiety, depression, insomnia, big pain in the joints, most of them, they are the signs of systemic inflammatory response, and majority of the patients who come to Ayurvedic practice, they are of this category. And of course these can be categorized into Vata, Pitta, Kapha. Again, the patients who have that insomnia, joint pain, etc. can be categorized Vataja. gastrointestinal tract disorders, majority of them could be pitta or so on. That's the way we can have that assessment of the chronic inflammatory response, that systemic shopha, the sarvagata shopha. Then, if these are not checked at that level, they can result in established diseases. Now, that's another important, and that word oxidative stress or oxidation and antioxidants, these are now becoming very popular. That oxidative stress is one of that next stage of the inflammation, which can result in many serious disease conditions. Lots of diseases, or rather at the present day situation, almost every disease is now assigned to the etiological factors related to oxidative stress, and among them very established conditions are hypertension, diabetes, heart disease, cancers, liver diseases, kidney diseases. These are well established factors which are produced due to the oxidative stress, and there is a practical issue about the treatment with the antioxidants in these conditions. Along with that, now lots of other issues are there. Now that's about the inflammatory response. Now coming to the other point, now what Sushila has said is the food factors which result in the shota. Now currently, of course, very recently, earlier this was not known in the Western system. Western system now has changed that approach, and currently the stress and the real truth comes in over the Western science, where the role of diet in the inflammatory response. Lots of research articles are now being published since past maybe around 15 to 20 years. This trend has become more popular. Earlier, diet and inflammation relationship were virtually not mentioned, practically almost not mentioned. Like some people would be commenting about that, but now there is a lot of new trend. The new trend in the contemporary system of medicine is to identify that role of diet in inflammatory response. There are lots of research articles. I have just listed a few of them important, which I consider important, and which gives a very broader outlook about the importance of the diet over the inflammatory response. Those who are interested, they can refer to these articles. Ultimately, in brief, if I have to make it as brief, the certain of those issues which are established facts about the inflammatory response of the body is, one is obesity. Obesity can result in altered anti-inflammatory regulation feedback, as well as it increases the adipokines and adipocytokines, and hence it can be, obesity can be is now considered as a rather number one, though not there is no such standard giving numbers, but if you consider that whole literature and the weightage, roughly we can give it as a number one factor which results in, or which provokes the inflammatory response of the body, resulting in that multiple conditions as such. Now, of course, this fact, of course, this slide has to be about the same. The issue is related to the obesity and the biomarkers. The biomarkers which can identify that possible impact of the obesity are these mediators of the inflammation which are linked to the obesity. These are the ones, and these days now the assessment of these parameters has become somewhat popular, and prediction of the obesity and attempting to manage the obesity with these biomarkers of inflammation. Of course, C-reactive, in this list uric acid is not maintained, but uric acid also is one of that issue which can result in the obesity conditions or tumor. These mediators of inflammation, which of those mediators of inflammation are increased or reduced, that's the total summary. Of course, in patient, those who manage the obesity, who are treating the obesity as a specialization, they may go into these issues as such. In the future medicine, this can become a routine investigation. At present, these investigations are not done as a routine factors, but obesity linked mediators of inflammation are now identified and they are becoming popular. Now, another issue is a junk food induced obesity. Now, it's a growing threat for youngsters. From the Indian point of view, one of the important articles. Now, though the issue, whatever we are discussing, is something different, I think one of the eye-opening article. I would like all of you to refer to this article in the obesity medicine 2021 publication, where you have a specific reference to the Indian condition, a pan-India survey organized by Central. Now I have just copied the sentence without any modification, and that sentence is a pan-India, one sentence from the whole this article junk food induced obesity growing threat to youngsters. And important, a pan-India survey organized by the Center for Science and Environment among 13,274 children between the ages of 9 to 14 years reported that 93% of the children, 93% of the children, stress upon that, ate packed food, and 68% consumed packaged sweetened beverages more than once in a week. Which now this packed food is one of the most important triggering causes for the systemic inflammatory response produced and related to the obesity. And 53% ate these products at least once in a day, and almost 25% of the school-going children take ultra-processed food with high levels of sugar, salt, fat, such as pizza and burgers from fast food outlets more than once in a week. Now, this is the real cause for majority of that health issues. Almost 90% of the health issues is related to this, and it can be a cause for multiple disease conditions in due course of time. That's exactly what I consider as the incidence of Sarvagata Shopha. Sarvagata Shopha is related to the diet. And now, very specifically, 5 types of the food that cause inflammation. These are now proved. I am just quoting from the proved sources like red meat and processed meats, including bacon or hot dogs, lunch meats, etc. They are considered as one of the important causes. Refined grains, including white bread, white rice, snack foods like chips, cookies, crackers, and sodas and other sweetened drinks, fried foods. These are the important causes of the triggering of that inflammatory response in the body. All these are the Vidahi Aharas. The whatever is considered as Vidahi Ahara are the same. Now there is a trend of anti-inflammatory food also, and one of the very popular anti-inflammatory food list is by Dr. Wheel's anti-inflammatory food pyramid, very popular one, and that food pyramid suggests about the choice of the food. The basic issue is that you have to have more of vegetables and fruits. Then gradually the list should be healthy sweets. Wine is next, which has to be consumed less. So this is the generalized suggestion of the diet to reduce that anti-inflammatory or inflammatory response syndromes. And of course, all the varieties of the food, proportionate quantity, suggested quantity based upon the statistics is mentioned here. And I think the whole picture is self-explanatory. The important is the maximum quantity of your diet should be vegetables and fruits. Then the least should be the sweets, drink, alcohol, tea, etc. These are the comparative list. In between you may have the other food as such. That's about the choice of the food which is suggested. That's about one issue. Then another important issue related to this systemic inflammatory response syndrome, that's the Sarvagata Shopha, is the exercise and the SARS. WHO scientific group on viral respiratory diseases, etc. The whole group has clearly detailed about that relationship of the exercise and that inflammatory response syndrome. And this publication or this issue has become more popular after the evidence of the COVID. Then there are plenty of other newer articles. Now, trend of the newer research. Now, I am just suggesting about the trend of the newer research is about the diet, exercise related to the health, and very specifically about the SARS asset. The trend of antioxidants are now becoming very popular. The word antioxidants, I think it has become very popular in majority of the Ayurvedic drugs and Ayurvedic herbs. They are now sold as antioxidants. It's one of the area where a lot of commercial activity is going on. So again, I will not go into much of the details. So these antioxidants being used as a health improving measures is one of the fashion now. That of course, ultimately the final is, it's not that it's only the overnourishment, even undernourishment can be a cause for the inflammatory response. Immunosuppression and susceptibility of infection could occur due to the malnutrition to those who are underweight. And immune activation and susceptibility inflammatory response also can occur in the overweight. So important is maintenance of a normal weight and the dietary factors. Now, in all this, again I will come back to the last. Now, this is the last sentence of this chapter, the of Sushruta. Whatever we now see as the major trends of the research is summarized by a single sentence by Sushruta. That's Pishtannamam Lavnani Madhyam Mridam Divaswapnam Ajangalanja Striyo Ghritam Tailam Payoguruni Shopham Jighamsu Parivarjayata. You have to avoid the Pishtanna, Amla, Lavana, etc. and the Divaswapna, that's daytime sleeping, and reduced exercise, excess of sexual indulgence, excess of Ghrita Taila, etc. also have to be avoided. Now, this is exactly the basic secret of the health, and whatever that Dr. Wheel's pyramid, that's nothing in front of what Sushruta has mentioned. That's all the point. And this is important, this is the last sentence of the chapter. Now, I have just jumped to the last sentence of the chapter, skipping many of the intermediate details of the chapter, only with the specific purpose to stress upon that issue. That's about the current trend about that issue, so far. Now we come to the specific sequential description of what Sushruta has mentioned, and then only you will be able to make out the value of this chapter. Tatra vatashvayatuhu arunaha krisno va muruhu anamastiraha tudadeshchatra vedam sheshaha. Patients who have that tendency of vata aggravation as a result of the inflammatory response syndrome, there would be a blackish color seen in the body. The body looks to be softer, and the pain and other symptoms could be the presenting symptoms. They are not very consistent. That's muscular pain, back pain. I think I have referred to that issue when we discussed about the clinical signs of such as the conditions which can be categorized Vataja. Or Pittashayatu, Pita Saratova, Mrudhu, Shigransari, Ushadeshchatra Vedanam Shesha, where the patient may have temperature and burning sensation as the symptoms. Shleshmashvayatuhu Pandu Shuklova, Snigdha, Katinaha, Shitaha, Mandanasari. Shleshmashvayatu Kapaja Dusti will present a paleness, heaviness, reduced activity, anxiety, insomnia, etc. Kanvadeshchatra Vedanam Shesha, Sannipata Shvayatuhu, Sabavarana Vedanaha. Sannipata Shvayatu will present with all these mixed symptoms. Vishanimitastu, there is one possibility of chemical induced or poisonous substances induced. Visha is not the only chemical, I think harmful chemicals, like not only the poison, it can be harmful chemicals, including what we call as junk food and so on. Gara Upayoga, now the present day situation, Gara is obviously the junk food. Dushtatoya Sevanata, that's Dushtatoya Sevanata is your aerated drinks, your these aerated drinks like Coke, so on. Then Prakutita Budaka Avagahanata, due to exposure to contaminated water, Savisha Sampadigdha Churnena Avachurnanadva, by applying some chemicals which are irritant substances over the body, the majority of the cosmetics which are used, they are Savisha Sampadigdha Churna. And Savisha Mutra Purisha Shukras Pashtanam Tradakashtadinam Samsurashanata, by coming into contact with the excreta of different animals. Satu mruduha kshipra utthana avalambi chalo va daharaga prayashta bhavati. It can result in sudden onset of the symptoms, which can be having a waxing and waning course of the pathology. These are the clinical symptoms produced that as such. Doshaha shvetum murdhum hi kurvanti amashayasthitaha pakvashayasthaha madhyeja varchasthanagatastvadha krisram deham anupraptah kuri sarvantadha. Now, depending upon the involvement of the specific organ, amashayagata doshaha, they tend to produce the shvetu in the upper part of the body. Pakvashayagata shvetu, they are mainly in the middle part of the body, and the sarvaprapta, the doshas which have vitiated the whole body, that can be producing sarvasara. Now, a certain of the issues which are related to, again, is a repetition of them. Earlier I have referred to the issue, but among them, the most important mediators of the inflammation which can present with these clinical symptoms and which can be to a great extent related to be serotonin. When it is released, it presents with the platelets and neuroendocrine cells like GAT. Primary function is as a neurotransmitter. It produces vasoconstriction, and the main symptom would be pain when the serotonin is released. See, whenever you have any injury, there could be different sorts of the response. Some of the injuries can present with more pain that suggests of the serotonin release, or rather in the early stages of the injury. The moment you have a trauma, more serotonin is increased. That's a sign of vata release. As such, prostaglandins are the next stages where the patient, it will be stimulating the mast cells, macrophages to come over there, and at that time the person would feel burning sensation. That's a sign of pitta. Or histamine could be the other way, which is often produced when there is an exposure to the chemicals as such, and it presents in the itching as a symptom. That's a sign of vata. So all that, the relationship between that different modes of that inflammatory response and the dosha lakshanas, they can be easily correlated, and they can also be used practically in the clinical course of the treatment. Again, we come back to the same issue of our continuation of the topic. श्वेतुः मध्यदेशे यः सकश्चः सवगश्च सः अर्धाङ्गे अरिष्टभूतश्च यश्च ऊर्ध्वं परिसर्पति श्वासपिपासा दौर्बल्यं ज्वरः छर्दिः अरोचकः हिक्कातिसारकासाश्च शूलं संक्षेपयन्ति हि सामान्यतो विशेषाच्च तेषां मोक्षां भेषजम्. Whenever there is a edema presented as localized edema, if the edema is presented in the middle of the body, that's abdomen area, as in case of cirrhosis, ascites-like conditions, or it could also be presented in obesity, where there is a obvious swelling in or bulging in the midline, sakastaha, that's difficult to be treated. And savangagata, those which present with the systemic involvement also are difficult to be treated. And ardhange arishtabhutascha, if it is only half of the body, or where there are arishta lakshana, that also is not possible to be treated or difficult. Along with that, those which present with the systemic symptoms like shwasaha, related to the abnormality of the breathing. Now, just remind about the clinical signs of the systemic toxicity, systemic inflammatory response, which we have discussed in the beginning. Same breathlessness, pipasa, daurbalyam, jwara, chardhi, arochaka, having jwara, vomiting, and the impaired appetite, respiratory abnormalities, shikha, atisara, kasascha, shunam, sankshepayanti. These are the signs of poor prognosis and they cannot be treated. Now, the general approach to the management is shopinaha, sarvayava parihareyu, angla, lavana, daji, guda, basa, paya, taila, ghasa, pistamaya, guruni. Those food substances which are heavy for the digestion or which can produce a vidahi or improper digestion, they have to be avoided, like amla lavana, which can produce a impaired digestion, gadi gudavasa, which are heavy for the digestion. Then vatashvetu, the other specific treatment is in vatashvetu, when there is a vata lakshan predominantly, trivrutam erandthailam va masam ardhamasam va payet. Erandthaila is considered as one of the better options of treatment for these conditions. Necrodhari kashaya siddham sarpihi pitto shayato, in a pitta shayato, necrodhari kashaya siddha, or arakudhari siddham sarpi shleshma shayato. Now, these types of the categories of the medicines can be used in a patient presenting with these vague clinical symptoms of the pain, and that vata pitta kapha approach, as I said, and that can be a very practical clinical approach which can produce significant results. Sannipata shvetu snuhi kshirapatram द्वादशभिः अम्लपात्रैः प्रतिसंसृज्य दन्ति द्रवन्ति प्रतिवापं सर्पिः पाचयित्वा पायेत. A snuhi ghrata can be prepared with the snuhi kshira and amla dravya, 12 parts of that. Then danti dravanti prativapa has to be added, which can also be suggested as a treatment. Adavardam samanya chikitsam upalekshamaha, general approach to the treatment of the shohva. Tilvaka ghata chaturthani yani uktani udareshu tato anyatamam upayajyamanam shvetum apahanti. The protocols of the treatment in the udara bayati can be used in the treatment of the shohva. Mutravarti kriyam va seveta, or the treatment which is suggested in the mutra ghata treatment also can be used. Navayasam va aharaha madhuna. One of the general specific treatments suggested is Navayasa loha continuously administered. Vidanga, Atibisha, Putajapala, Bhatradaru, Nagara, Marichachurnam va Dharanam Ushnamuna. These Vidanga, Atibisha, etc. To be consumed every day with warm water. Trikatu Kshara Ayas Churnani va Tripala Kashayana. With the Tripala Kwata, Trikatu Kshara Aya, this iron as such, Loha Basma. Mutram Matulya Kshiram with Gomutra or with the Kshira. These are all the different options which can be tried. Haritake Matulya Gudam Upegita, Haritake with the Guda, Devadara Shuntima, Devadara and Shunti, Gugulma Mutrana Varsha Bhu Kashaya Anupanam, Gugulu with the Punarnava Kashaya Anupana, Tilegudam Shungaberama, Guda and Shungavera, Shunti again, Varsha Bhu Kashaya Mulakalkama, Sashungaberam Payo Anupanam Maharaha Mamsam, Vyosha Varsha Bhu Kashaya Siddhenava Sarpisha Mudgolumban Bhakshayeta. These are the different with prepared with the mudga as such. So on. Now the whole issue is about the different options of the diet supplement which can be used to treat these conditions of systemic involvement of pathologies. And Pipali Mula Chabya Chitraka Mayuraka Varshabhu Siddhamva Kshiram Viveda Saha Aushada Murangi Mula Siddhamva Trikatuka Eranda Shama Mula Siddhamva Varshabhu Shungavera Saha Devadava Siddhamva Tata Alabu Vivitaka Palakalkamba Tannulapana Kshira Pipali Maricha Shungavera Anusiddhena Mugga Yushena Alavanena Alpasnehena Bhude Devanam Godhumanamva Vrikshaka Arka Naktamala Nimba Varshabhu Kwatescha Parishekaha Sarshapa Suvarchala Saindava Shangesabhischa Pradeh Karyaha Yathadosham Vamana Vilajana Asthapanani Tikshnani Ajasram Upaseveta Sneha Svedopanahamscha Sirabhischa Abhiksham Shonitam Avsejayal Anyatra Upadra Shopabhiti. Now, to prevent as well as cure, you have plenty of different options which can be used based upon the availability of the drugs, which can be considered selected based upon the constitution of the patient and the other symptoms as such. So, you have plenty of options which can be selected without bothering about the doshas. These are the Samanya Chikitsa. And one of the general Samanya Chikitsa is a Omana Vilachana Asthapana, which have to be given sequentially and regularly. The again repetition of the same sentence which I have quoted earlier, the last sentence is and summary is Pistannam Amlam Bulavadanam Madhyam Mridam Diva Swapnam Majangalanja Striyo Grisam Taila Payo Guruni Shopam Digam Suparivarjayata. Or a simple translation would be you take care of your diet and exercise, then the disease can be prevented and cured. With this, we complete this chapter. Iti Sushul Samhitayam Chikitsastane shophachikitsa Nama Trayom Shodhyayaha. With this, we will conclude. If there are any questions, we will try to answer. Right, there are some questions. Can you please elaborate role of test in information process? Yeah, of course. Rest or test? I think it's about the test. No? Yes. ESR. Okay. Sorry. Role of ESR. I think I have already referred to ESR also is a mediator of information which is totally non-specific. It doesn't specify anything. Any sort of chronic inflammatory condition as well as acute inflammatory condition, ESR is raised, which is produced due to the coagulation factor. See, in the mediators of inflammation, one set of the mediators of inflammation would be enhancing that coagulation factors, and that's exactly the point which can result in that. Then there is another question is inflammatory conditions like cholecystitis which is present in Madhya Sharira, are they also difficult to treat? Yes, of course, they can be considered as difficult to be treated. So whenever that's difficult to be treated from the point of view of managing only with the Ayurvedic treatment conditions, Ayurvedic treatment options. Now with the different options like antibiotics or maybe the surgical options, you may have a different sort of prognosis. That's the other issue. But it's a difficult to be treated. That's all the issue, right? Sir, any more questions? Someone has raised their hand. Like, right. So with that we will conclude today.